So here's the little summary that Google gave me when I searched the term gastrocolic reflex. The gastrocolic reflex is a physiological response that controls the motility or movement, the ability to move, of the gastrointestinal tract following a meal. It involves an increase in motility of the colon, consisting primarily of giant migrating contractions or migrating motor complexes, fancy words, in response to stretch of the stomach following ingestion, meaning eating, and byproducts of digestion entering the small intestine. It's not a disease or medical condition, but rather a normal reflex that helps the body make room for more food within the GI tract after eating. It is what makes you feel the urge to have a bowel movement soon after eating. Some people have a very active gastrocolic reflex, especially those who suffer from irritable bowel syndrome and feel the need to go to the toilet shortly after eating. In most people, this reflex is less active and we don't notice the urge to go right after eating. The point of this is that everyone has this reflex and it doesn't simply go away in newborn babies at 1 month old. It is possible that it becomes less active and that as the baby grows and develops, the anatomy and physiology of their large bowel changes slightly. So what is the puborectalis? This is a key piece of the puzzle. The puborectalis is a sling-shaped muscle which forms part of the levator ani, a part of the pelvic floor, which helps to keep the pelvic and abdominal organs up inside the body. The role of the puborectalis specifically is to keep the rectum closed when we are sitting, standing, or lying down. So this is what helps us to not suddenly lose bowel or bladder control in social situations. Now, even though you may be used to the regular position of sitting on the toilet, you need to be aware that the puborectalis can slide upward, releasing its grip on the rectum and allowing it to lose the kink that it normally has and straighten out. This creates a much easier position for having a complete bowel movement and also for complete emptying of the bladder. If you've ever been to Dubai airport when traveling, or many other countries that still have the biologically normal habit of squatting when using the toilet, you may have seen these kind of toilets. You might even have thought them somewhat barbaric or strange, but in all honesty, if everyone used the toilet this way, most of the constipation, impactions, diverticulitis, and bowel cancer in the world would magically disappear overnight. There are little steps that go around the base of the toilet that encourage one into the squatting position or closer to it, which have been shown to have a profound impact on the health of the entire digestive system, reducing constipation pretty drastically. So how are babies supposed to adopt a squatting position in their crib, tightly swaddled, with no way of bringing their knees up to their chest? I'll explain how to do this for your baby to help them empty their bladder and bowel completely, which will make it easier for them to latch and drink, help them sleep more soundly, and improve reflux, gassiness, colic symptoms, and just help them to feel better in general. So if other cultures use toilets differently than Westerners do as adults, do they do things differently with their babies than we do? Yes, they do. You may not be aware, but about 80% of the population of this earth do not use diapers like we do. In China, India, most of Southeast Asia, most of Africa, Central and South America, parents start taking their babies to the potty or the toilet at only a few months of age, and some start from birth. Now, before you freak out, thinking that we are opening Pandora's box here and you are going to have to start taking your baby to the potty 10 times a day to keep yourself sane, take a breath. I have co-authored a 70-page ebook about how to do exactly that if that is what you would like to do, like these parents. But if that's not something you want to commit to quite yet, that's totally fine. It's enough to learn how to help your baby to eliminate completely when they're having these episodes where you can clearly tell that they need to have a bowel movement, but the problem is not their lack of muscle coordination, it's that they're not in the biologically correct position. So yes, you definitely can use diapers and still keep this knowledge of how to help a baby who is struggling with diapers whenever you feel they really need it. If you want to know more about elimination communication, you can grab our ebook in the link in our bio. It's called Undiapering. It explains what to do, what not to do, when to do it, how exactly to do it, how to know when they need to go, how to know when they're done, what to do if they need to go while they're drinking or sleeping. It can be read in an afternoon and includes a ton of illustrative images and diagrams and links to cool resources. But if you're just going to be using the squatting position to help your baby deal with the occasional discomfort and difficulty, I'll break it down for you in the next video.